Now with a segment on postpartum depression, here's our reporter, Laura Windsor.
The birth of a baby can trigger many emotions, from joy and excitement to anxiety. Some women also experience depression. We hear about postpartum depression from Dr. Vinayak Shanbhag of St. Joseph Hospital in Orange, who explains the condition and the importance of prompt treatment.
Postpartum depression is a mood disorder that typically occurs after childbirth and within the first month. It is differentiated from postpartum blues, which are fairly common, and 50 to 80% of the women who deliver after childbirth do develop postpartum blues. And postpartum blues typically last about 10 days to 2 weeks, and they could get better with time. Whereas postpartum depression is a little bit more serious condition. It occurs between 10 and 15% of the time after childbirth, and the symptoms can occur anywhere between the first month post-delivery up to a year after the delivery. The symptoms are a little bit more intense in postpartum depression, and the symptoms are long-lasting. Women in postpartum depression, they feel sad, they feel helpless, they feel overwhelmed, get very frustrated, feel that that she's not a good mother, that she can't take care of the baby, extreme shame and guilt, and sometimes women in that state of mind also think about dying or suicide. And the mom feels so intense with this gloominess and sadness, and consequently believe that she is not a good mom to take care of the baby. Postpartum depression will interfere the bonding issues because of that. Mom have difficulty bonding with their infants when they are depressed or depressed state of mind. Depression can be familial. If you have a family history of depression, there's a high likelihood that you'll get depressed during the pregnancy. If you had a past history of postpartum depression, there's a likelihood of you getting postpartum depression again in the second pregnancy, at least 50% likelihood. And if you had 2 or 3 prior episodes of postpartum depression, it's nearly 100% likelihood that you'll get depressed again. It's sometimes very difficult to say why one family member is not depressed again as opposed to the others. It's a combination of several factors, genes, and also the stresses that a person is going through in their life. At St. Joseph's Hospital, we have a support group where the women meet once a week, and we encourage them to bring their infant. And there are moms in that group which have been coming for several weeks, and they have in different stages of the recovery. There are some moms who are just very, very depressed coming for the first time, and other moms who are ready to graduate and willing to share about their own experiences. And that is a very, very powerful treatment too. And the group is conducted by a licensed clinician. It's not just a mommy and me group, but it's a treatment group. Depression can be successfully treated, and particularly postpartum depression, usually the combination of counseling, judicious use of medication, as well as group and support therapy.
A woman experiencing postpartum depression has to be treated immediately because it's not only her welfare at stake, but also her baby's. For the American Health Journal, I'm Laura Windsor.